The notion that vaccines are propaganda and make individuals weak and sick has gained significant traction in recent years, particularly on social media platforms. Proponents of this claim argue that vaccines are not only ineffective, but also hazardous to one's health, citing alleged links to various illnesses and conditions. However, a closer examination of the scientific evidence and historical context reveals that this assertion is fundamentally flawed. Firstly, it is essential to understand the fundamental principles of vaccination. Vaccines work by introducing a small, harmless piece of a pathogen, such as a virus or bacteria, to the body, which triggers an immune response. This response enables the immune system to recognize and combat the pathogen, providing immunity against future infections. The development and administration of vaccines have undergone rigorous testing and scrutiny, with numerous studies and trials demonstrating their safety and efficacy. One of the primary concerns raised by those who claim that vaccines are propaganda is the alleged link between vaccination and the development of autoimmune diseases, such as autism. However, numerous studies have thoroughly debunked this claim, with the Centers for Disease Control and Prevention (CDC) and the World Health Organization concluding that there is no scientific evidence to support a causal relationship between vaccination and the onset of autism. The now retracted 1998 study by Andrew Wakefield, which initially sparked the controversy, has been widely discredited due to methodological flaws and ethical concerns. Moreover, the argument that vaccines make individuals weak and sick is not supported by empirical evidence. In fact, the overwhelming majority of vaccine recipients experience only mild side effects, such as redness or swelling at the injection site, which are typically short-lived and self-limiting. Serious adverse reactions to vaccines are exceedingly rare, occurring in less than 1 in a million cases. In contrast, the benefits of vaccination are well documented, with vaccines having prevented millions of cases of infectious diseases and saved countless lives. Another misconception perpetuated by those who claim that vaccines are propaganda is that a healthy diet and lifestyle can provide sufficient protection against illnesses, rendering vaccination unnecessary. While a balanced diet and regular exercise are indeed essential for maintaining overall health and well-being, they are not a substitute for vaccination. Infectious diseases can affect anyone, regardless of their health status, and vaccination provides a crucial layer of protection against serious and potentially life-threatening illnesses. It is also important to consider the historical context of vaccination and its impact on public health. The introduction of vaccines has led to the near eradication of numerous infectious diseases, such as smallpox, polio, and measles. The decline in vaccination rates in certain regions has been accompanied by a resurgence of these diseases, highlighting the critical role that vaccines play in maintaining herd immunity and protecting vulnerable populations, such as the elderly and young children. In conclusion, the claim that vaccines are propaganda and make individuals weak and sick is not supported by scientific evidence. Vaccines have undergone rigorous testing and have been proven to be safe and effective in preventing infectious diseases. While concerns about vaccine safety and efficacy are understandable, they should be addressed through a critical evaluation of the available evidence rather than reliance on misinformation and unsubstantiated claims. By promoting vaccination and maintaining high vaccination rates, we can protect not only ourselves but also our communities and contribute to the ongoing quest to eradicate infectious diseases and improve public health outcomes.